I'm Kyle Fletcher. I'm an ear, nose, and throat doctor, and I've worked for Ephraim for almost 2 years. I moved a lot as a kid, but I spent middle and high school years in Elizabethtown before coming to UK for undergrad, and I just never left UK after that. So I came here 2 years ago, and so you could say I bleed blue. I'm not taking care of patients or spending time with my family, my wife and my 2 children. I really love music. I like to play the guitar and try to learn some new songs and things like that. I've also been taking American Sign Language lessons for the last year or so, trying to get to the point where I can communicate with some of my patients with sign language. I think the thing that drew me into medicine was a lot of the relational aspects, getting to know your patients, really understanding what's been bothering them, and then trying to help them through their medical problems is something that's really rewarding to me. Getting to see people multiple times over years is really rewarding. It's a tough question. I think I'd probably be a starving artist somewhere, playing live music. I think the practical side of me drove me to do something with a more stable lifestyle. I did undergrad, medical school, and residency all at the University of Kentucky. I really was drawn to ENT really by some of the people in it. A lot of my mentors that I got to know very well were just my kind of people, and I liked the balance that it provided. A lot of people, even my parents, didn't realize that ENTs are surgeons also, but we do a fair bit of surgery, and about half of our time is doing operations, half of it's in the clinic, and then we also see patients in the emergency room and in the hospital when there are emergencies. So I really like that variety. Yeah, I think the variety is one of my favorite things. I also really like that we're a specialty that we see all ages. I saw a newborn in my clinic today all the way up to someone who was 97 years old. So we see kind of all stages and walks of life and a lot of different medical problems. When you come to our office, you'll be greeted by our awesome staff. We really have a great group at our office. They'll take down your information, get you registered, and then they'll take your vitals and set you up in an exam room to be seen by one of the physicians. And that will start out similar to most office visits you've had with a physician, but what you may not know is that we do a lot of specialized exams in our office. We may use a microscope to look or clean out the ears. We may also use flexible scopes or rigid scopes to look in either the nose or the throat, sometimes on a big TV screen so everyone can see well. So we really try to do some of those additional investigations in the office to really get at the diagnosis. I love my practice because I feel like I have just a great breadth of things that we take care of here in Danville. We really try to provide the best techniques and cutting edge procedures and surgeries to Danville. We try to offer everything we can without having to refer out to some of the larger centers. But I really like the fact that we see a lot of kids and take care of pediatric ear, nose, and throat problems. We do a lot of nasal and sinus surgery, ear surgery, thyroid and parathyroid surgery, as well as head and neck cancer. So it's just a great variety. The most rewarding part for me is seeing my patients get better. Remembering when they came in and were having problems or issues that hadn't been treated successfully, diagnosing that, and then potentially doing a procedure that they recover and heal from, and then when they come back and they're just feeling so much better, that's really the best thing in my day.